Hi, everybody. Erin Troy, here to give you a nice slideshow or a PowerPoint on social work with children and adolescents with medical conditions. So, with no further ado, forgive my tech savviness, that's not really on point, but we're just going to make it through. Okay. What makes working with children and adolescents different from a typical social work role? I would say the big piece that is with children is having to add school and education into the collaboration. Social workers have a special opportunity to both educator and advocate, making certain everyone is aware of the legal rights of their patient/student. FAPE is huge, free, appropriate public education. Everyone is entitled to it, no matter what the accommodations are. Just an example is an individual education plan or an IEP. The social worker's role is to make certain all therapeutic and social skills goals are being met and that the plan in general is being followed within compliance of what the team came up with for the IEP. Another special, I guess not special, but different, is bringing the school nurse on board. Privacy laws really prohibit social workers from sharing unnecessary pieces of information. The school nurse should know just enough to monitor and maintain health during school hours. Whatever is shared becomes part of the student's permanent record, so you kind of want to be careful about what you disclose. They care for siblings of the patient. Oftentimes, the focus is placed on supporting the patient and their caregivers. Siblings need supportive services as well to process the situation and to prepare for what the future might hold for their brother or sister. The need to address future plans in regards to fertility. Fertility is obviously not most likely going to be focused on fertility, so the social worker must make certain everyone is well informed about the possible dangerous side effects of the treatment, as well as being informed about the methods to which fertility can be preserved. Be it frozen, in vitro. There's many, obviously, as time goes by, there's more and more and more modern medicine enhanced ways to have children. But a social worker should be really versed on that. The loss of a young life can be traumatizing for all involved. I mean, it just feels wrong, which sounds uneducated, but it just feels wrong. It's difficult to acknowledge or witness both the sudden demise of a young person in an emergency department or the steady deterioration of a child when the medical team has concluded there's nothing left to be done to help. It's a hard pill to swallow for everyone involved. Two challenges, needs specific to working with children and adolescents. Staying positive and maintaining a positive tone. Children often look to adults for their reactionary cues. Maintaining a somewhat cheery disposition when discussing end-of-life care for a child is next to impossible, but the following guidelines can certainly help achieve the highest level of positivity possible. Set clear boundaries between home and work. Sometimes you have to leave it at work and separate yourself. Seek supervision from professionals in the same field or related field, just a check-in person, a checkpoint. Organize a support group for colleagues. I'm sure if you are suffering, you are not the only one in your field suffering. Spend time with healthy children to maintain perspective. It's not all gloom and doom. It's not all negative and just heartbreaking. Engage in rejuvenating experiences. I don't know, go jump out of a plane. Go do something that just gets your adrenaline pumping and releases positive endorphins. Find ways to relieve stress. Self-care, super important. Accept your limitations. We cannot do everything. Find comfort in the patients and the families you are able to help, because you know what? We can help a lot of them. Vicarious traumatization, I felt was necessary just to add. It's the experience of a helper who identifies and empathizes with the physical or psychological pain of the client to the extent that the practitioner becomes traumatized. When you're in and you're overwhelmed and you're just taking it all in and you don't have a balance of self-care, Actually, that's where the balance of self-care comes in. It's almost as if you've gone through the trauma as well. So now you need to seek treatment or self-care. So self-care, a simple and basic concept, which is oftentimes not made a priority for those in supportive caring roles. We cannot give what we don't have. And if our health is suffering, we cannot expect to help our patients to be mentally, physically, emotionally, and spiritually healthy as possible. Number 2, maintaining clear communication through the patient's systems. There's a lot of systems when it comes to kids or adolescents. As social workers working with children and adolescents, it's responsible for keeping the patient's networks connected and on the same page. Collaborating family, community, school, and medical settings can be quite the juggling act. What resources would a social worker need to work with children and adolescents? A social worker needs many tools in his or her toolbox to be successful in helping others whilst maintaining some level of sanity. Informative or information and education, access to training, networking inside and outside the medical setting, and a strong support system at work and outside of work. What resources would the patient need? The patient would need resources to keep their systems connected and to help them learn to process and cope with their medical conditions. Some examples are as followed. Thank goodness most pediatric hospitals have a child life department. It's dedicated to improving the quality of each patient's life during their stay. These services can be anywhere from entertainment, play therapy, guided imagery, meditation, help with development of coping skills, and anything else the patient would need to maintain some level of normalcy, which is really hard. Access to FAPE, again, free, appropriate public education. Some patients will have limitations, be it from treatment or just in general, physically, mentally, developmentally, emotionally, or psychologically. The social worker needs to make certain that accommodations are made to give the patient, student every opportunity to be successful. Social workers will need to stay up to date on all laws pertaining to the rights of the student. A social worker will be well versed in frequent pediatric illnesses. Sometimes the patient is too young to understand what is happening to them. An educated, well-informed social worker can advocate on the patient's behalf and can break the information down to a level that the patient can understand. This is often beneficial for the family as well. Awareness of all the social work departments has to offer them and their caregivers. Though social work plays a vital role in improving the quality of care in the medical setting, studies show that there is a lack of awareness of services performed by social workers amongst patients as well as with doctors. In a medical setting, the illness or diagnosis tends to take center stage, leaving the practitioner in the lead role. Unfortunately, this leads to missed opportunities to treat the patient as a whole. How would you as a social worker distinguish yourself from others working with the same patient? Be the gatekeeper, and I love this. In 2012, a social worker in a medical setting took on following roles: mental health practitioner, discharge planner, interdisciplinary team member, cultural liaison, chemical dependency counselor, reporter of abuse, neglect, and finally, patient advocate. When working with children and their families, the role of advocate must shine through. To play this role effectively, one must maintain good communication between patients, families, caregivers, schools, and staff. This can be achieved through using active listening skills, asking questions on behalf of the patient or family, having an arsenal of resources for during and after treatment, and by being present and accessible, and by emphasizing or empathizing with the patient and their family and just showing compassion. And that's about it. I'm sorry, I didn't know that was my last job, but that's about it.